everyone, I'm here with Vicky Ruffing, nurse and director of patient education from the Johns Hopkins Arthritis Center, to talk about a really important topic, which is barriers to immunization in patients with rheumatic disease. And she recently published an article on this topic. And so thank you so much, Vicky, for joining us.
You're welcome.
To talk about this important work. I'd like to start by first talking about why immunizations are so important, in particular in patients with rheumatic diseases.
Patients with rheumatic disease, as you know, have a compromised immune system, which means they are not as well adapted to be able to fight off any type of viruses, flu virus, for example, that would come their way. So what we are trying to do with vaccines is obviously give our patients the very best defense that we can. It's important for all patients, but especially our patients, because they can be a little bit more susceptible to any virus that's coming down the road.
What did you notice happening in the clinic and in the literature that prompted you to look at this issue more closely?
Well, I think the barrier is that really we have a hard time with many adults receiving vaccines. But with our patients with a rheumatic disease, they have some preconceived myths, if you will, as to what a vaccine might mean for them. So for example, patients feel like, oh my gosh, if I get the flu vaccine, I'm going to come down with flu. And whereas if I'm, washing my hands and being diligent, I may not come down with flu.
Okay, so then in thinking about risks versus benefits, what were the major concerns that patients had that prevented them from getting vaccinations?
Well, the risk of not getting a vaccination is that patients with rheumatic diseases, patients that are in our arena, will often get a worse case of flu. So their bodies are not really tuned well enough to be able to fight off flu. So the outcomes can be much worse than they would be with the general population. So what we've seen is that patients with a rheumatic disease often end up hospitalized as a result of flu, whereas your average adult may not be. So that's one issue. One of the risks of vaccines is you may get a localized reaction. That is pretty much it. Some people get, a sore arm. Some people may get a very low-grade fever, around 99.1, something like that, but it's certainly not anything flu-like.
Other than the physical symptoms that patients could experience, were there other barriers, logistical barriers, that prevented patients from receiving them? Well,
there are barriers as far as access to vaccines. Certainly within recent years, it seems like you can get a vaccine anywhere. So some of those barriers have been torn down. You can go to your local pharmacy. Sometimes the grocery stores have a marathon, the mall. A lot of health departments have vaccine campaigns. So vaccines seem to be pretty available. Sometimes I think our patients with a rheumatic disease are a little more cautious about should I talk to my doctor first about vaccines. So one thing that we found very helpful, and we do it in the Arthritis Center, and actually all of our centers here in the Division of Rheumatology, is offer the vaccines at the time of their visits. So we usually have flu vaccines starting in September, and patients can get their flu vaccine while they're here having an appointment for a regular follow-up.
That's great. So if I was a patient who came to see you in the Arthritis Center and I had fears or I didn't know about the importance of vaccines, what would you tell me?
Well, the first thing I would tell you is often people think they're going to get the flu, and that is a myth. One thing to remember is that it takes 2 weeks for a vaccine to really build up those antibodies, which means just build up the defense that's to the vaccine. We really encourage you to give yourself the best possible defense you can against things that we know vaccines will prevent. So I would hope that would help you understand the importance of why you should get your vaccine.
Absolutely. Well, thank you so much. We look forward to seeing what you put out next and educating our patients into the importance of vaccines and other things. So thank you so much for joining us.
You're welcome.